Vipul Janardan. I am at the Institute of Human Behavior and Life Sciences, New Delhi. So I will be talking about chronic fatigue syndrome. So chronic fatigue syndrome is also called myalgic encephalomyelitis or immune dysfunction syndrome. It is named with various names are there. Coming to the epidemiology, around it is prevalent around 0.5% in the population, and more predominantly and dominantly in the female. Around age of onset is around 29 to 35 year of age. Mean illness of duration is 3 to 9 years. Coming on to the criteria of CFS, that is chronic fatigue syndrome. So it is characterized by persistent or relapsing unexplained chronic fatigue of new onset lasting at least 6 months, which is not result of any organic disease, of continuous exertion and not alleviated by the rest. Four or more of the following symptoms concurrently present for more than 6 months: impaired memory, concentration, sore throat, tender cervical or axillary lymph node. Muscle pain, muscle pain is also there. There is pain in the pain in several joints, slight joints, new headache, unfreshing sleep, or malaise with exertion. Exclusion criteria include major psychiatric disorder or such as psychotic depression, bipolar disorders, schizophrenia, dementia, eating disorder, or alcohol substance use disorder. There's things to note. This non-psychotic psychiatric disorder are not exclusion criteria for the diagnosis of CFSS. The core symptoms of the CFS is fatigue. However, pain and cognitive difficulty can be a prominent as fatigue. Almost all patients developed a functional impairment. Social relationship are affected by patient like around 33%. They are unable to work, and 33% can work only part time. So, according to the NICE guidelines, symptoms that might indicate another serious illness include significant weight loss, clinical significant lymphadenopathy, localizing or focal neurological signs, features of inflammatory arthritis, connective tissue disease, or cardiorespiratory disease, and sleep apnea. So onset is generally sudden and noticed after an episode of viral or viral infection, especially in patient presenting to the tertiary centers. Eh, and coming on to the other factors, or the management part. So then CBT is the best way to approach, but CBT is like cognitive behavior therapy. It is not a cure for the CFS, but however it is an effectiveness can last for at least up to the 5 years. CBT targets the cognitive and the behavioral element of the CFS, and the current evidence suggests that that the misperception of the cause of the illness or avoidance of the activity or excessive rest perpetuate the symptoms of CFS. CFS. Component of the CBT in CFS is explanation of the etiology of the or etiological model or motivation for CBT, challenging and changing of fatigue related cognitions, achievement and maintenance of basic amount of physical activity, gradual increase in the physical activity, rehabilitation, for example, rigorous self monitoring, a self behavior in social phobia can feed to the core symptoms. So these are the symptoms. Another strategy is pacing. It is a good strategy in case of patients suffering from CFS. In this, they are encouraged to achieve a balance between the rest and the activity. This involves some limited type of activity alternating between the rest. The aim is to prevent the vicious cycle of the overactivity and the setbacks, that is boom and bust, while setting realistic goals for increasing activity when appropriate. Theoretically, it is based on the conserving energy to be used wisely. Pacing is a recommended by patient groups, but it is Although this effectiveness is questionable, uh, other things, or in case of CFS, SSRIs are the drugs that can be used in case of CFS, along with the CBT. So, and graded exercise therapy. What is graded exercise therapy? It is a physiological model of deconditioning. So, muscle strength, autonomic response, and perception of exercise related sensation are effective of inactivity. Therapy aims to gradually increase the exercise and other activity, thus reducing the unwanted consequences and of inactivity. So thank you for this is all about CFS, or chronic fatigue syndrome.